So the next beef enhancement study that we're going to speak about or visit about is with Dr. Raoul Boughton. Dr. Boughton is the wildlife rangeland specialist here at the Range Cattle Research and Education Center. He is from Down Under. Dr. Boughton's research focuses on promoting the conservation, maintenance, and improvement of rangelands for diverse ecosystem functions with special attention to wildlife. He's going to speak about another multi-year study, the Florida calf loss study. He's going to provide a summary of the 2017-2018 herd results.
Thank you, Bridget. Okay, so how did a wildlife biologist have anything to do with calf loss? Any ideas? Why would I be interested at all? No ideas. You know. Well, yeah, because he says because the coyotes maybe do it. So I got involved with calf loss initially because we were interested because of a predator-calf interaction and whether or not predators were truly causing calf loss, which they do here, and how much of that did they actually do. There's another gentleman in here somewhere. Actually, I can see him. He's on his phone. He's not even listening. Marty Main back there also undertook a study on predator interactions with calf, and that was actually down around the Big Cypress area, specifically focused on whether or not Florida panther were taking calves. And they do, and in that particular study, Marty showed at times that can be 5%, and that's quite high. So we're talking about wildlife interactions with calf loss, and then the question always comes up, what is the percent that these predators actually cause of that total calf loss? And how often are they killing calves or are they scavenging calves? And how often are we getting it wrong ourselves by interpreting what we see incorrectly, which happens all the time on the Lightsey Ranch, doesn't it? Yeah. Oh, and by the way, he also shoots my actual study animals, which is always really, really hard to do good studies on ranches when they take out your animals that you actually need to study. It was a good study. But I'll give you an example of this. So we had actually one of the first calves that died during this particular study was hard to find. It was the first one. We'd had a signal that this cow was going into birth, and we'll talk about that in a minute. And we're looking for the cow. We can't find the cow. And it's down in the Big Cypress, and there's lots of bayheads there, and it's difficult to find. It takes us probably 24 hours at least to find that cow. We eventually find the cow because there's some buzzards around the back of a bayhead standing up or sitting up one morning, and we go looking. And so we find the cow and eventually find the calf back there in the bayhead. And it looked pretty bad. It was rotten. It looked like it had torn skin on it and had twisted ears, and the ears were actually half off. And a gentleman there said, "Oh, that's a coyote attack." And I said, "Well, we need to find some evidence. It's the ears. It's ears. The coyotes grab the ears and they twist them down like that." And so we said, "Okay, that's probably a potential." And we go through it. We skin this calf out and we look at it. There was no other evidence whatsoever that a coyote actually killed that calf. And so what we find out after we do a little bit of work, we ask around a few people that know more about looking at old dead calves than I do, and this is 24 hours I'm saying dead. It was actually vultures do that too, and people probably have seen that. So they'll come in, they'll grab ears, tails, things they can grab, and they'll twist it and they'll make it look different. The point is the initial investigation or interpretation by the person on the ground was that it was a coyote, and it actually wasn't. And that's sort of the purpose of this study. What are the causes of calf loss we are seeing, and how can we accurately do that? That raised all sorts of difficulties. First of all, how do you find the calf? You're out there, you've got a 200-acre field. It might be grass, it might be woods and grass. How do you get to that calf? How do you find it? How do you know that cow has just given birth? And that was one of the stumbling blocks or difficulties, even in Marty Main's first study, is actually how do you get to that cow early enough when she's actually calving? And very recently that's been possible, and I'm going to hold one of these up. This is actually a cattle birthing sensor. So this actually goes up into the birthing canal and sits against the cervix like this. And you can have a look at this. This is actually a device that has a radio frequency in it, and it communicates backwards and forwards with a base station in the middle of a pasture. And this study allowed us to test how far we could do that. So what was the footprint that we could actually tell when a cow was giving birth in? And it's approximately 400 to 600 acres, depending on how much interference you have from different trees. So that's the first step. Great, we can actually we know a cow is giving birth, and it will tell us through that base station. The base station has a cellular network attached to it. So all of these technologies we didn't have 20, 30 years ago the same way. And it sends a signal to a server that actually sits in Amsterdam, New York. And then that talks back to me and all the field research people on this project, and it says, okay, calf is imminent, it's going to be born. And so we respond. And we try and find that cow, which is a lot easier now that we know which one we're after and where it's actually calving. Now that particular sensor, it does that, but it also has a flashing beacon in it. So at night you can see it. And it also has a Bluetooth device in it. And that Bluetooth is, in your phones, you sort of connect to your car or computer board, and you can get about 75 to 90 feet. You'll be walking past it. I have a Bluetooth receiver just on your phone. It'll start beeping. It's over there. The sensor's over there. So we go and do this. Is Cliff out there? How easy is this to do? He's laughing. So even with all of this help that we've been doing, and we put in a lot of effort into this, and there's been a lot of work done to put into getting these sensors to work in this, it is really, really hard to actually find those sensors. And I'm pretty open with this, and it doesn't actually help when not all the sensors work properly. So we have about a 20% failure rate on our actual sensors in terms of technology issues, and that's an issue for us because it makes a lot more labour. Anyway, so the process goes through. We say we find this calf, it's nice and healthy, it gets up, it does the normal thing, it starts to nurse, it's doing great. From then on, we go into classic wildlife mode or wildlife technology equipment, very similar to what was used on the first study, and we stick a tracking VHF receiver in the calf's ear. So this particular device gives off a constant pulse rate. It says calf's fine, it's moving around. If it actually goes still, that pulse rate changes and it becomes double the rate. So it goes beep, 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 beep. And it's basically a mortality signal. So this is not giving off a mortality signal, but this can go round too. So these two pieces of equipment are allowing us to get to birth and then track a calf. And that stays in that calf until weaning. Okay? So now we can actually look at calf loss from late gestation, since we put the birthing sensors in, all the way through to actual weaning. And we've done that on 2 herds so far, and it's actually in a 3rd herd right now. So that gives you a brief idea of the actual technology that we're actually using. But what I wanted to actually also tell you is that the effort collaboratively to get this study off the ground was enormous, and it was really important that everybody who had a stake in what was going on was actually involved. So that included mainly ranchers and getting ranchers on board to actually be able to do that. And I want to especially thank Longino Ranch and Buck Island Ranch and Big Cypress Seminole Tribe for actually supporting being able to do this on their locations. It's a lot more work than we ever thought it would be, like everything, and it's hard to do. So after we had tested both of these pieces of equipment, it would have been late 2016, we went full on. And we said, what is the size of the herds we're going to do? And we said, we want at least 110 cows in each herd if we can do it. The reason we want to do that is that so we get enough sample size. So if you have 110 cows, okay, that are palpated or ultrasounded pregnant, how many of them should bring a calf to the pen in Florida currently? What was that? 90? 65%. Oh, no, can't be 65%. I hope not. But I will say, calf loss is highly variable in Florida, and it can range from, and I'm talking about pregnant cows here. This is after you know they're pregnant. So from pregnant cows, it can range from about really 4 to 6% up to 20% in different places. And the reason we've wanted to do this is to figure out what's causing that 20%. Is it predators? Is it environmental conditions? Is it other things? And it's allowing us to do it. The national average loss in the US is what? Does anybody know? High. It's actually higher, but it's pretty close. So it's actually 6%. So actually about 6% calf loss. All right. The typical loss that we see on the Range Cattle Research Center has been about 6%. Although is John around? He said, "You're lying, no way." And he said, I remember when I first came here, he said, "No predators take calves on this research center." Yeah, right, sure. We won't go there. But there's been predator losses even here, okay? All right, so moving forward, when we set this up, we go and we choose an area that's 400 acres, 600 acres. We erect a tower, and you can see this on page 19. There's a few images there. We insert, if you go over to page 20, we insert these actual sensors, and then we actually collect baseline metrics on that herd too. So at that time, we actually do a couple of things, but typically we draw blood, we look at the cow, we do a body condition score, which we're going to have to do some training for now. And I will do that myself. And after we've done all that, we just monitor the herds, okay, until birthing starts. And so that usually occurs about 3 months before the first calf or so. And calving in Florida only takes 60 days, doesn't it, in all these herds? This lady's laughing really hard. No, it takes a lot longer than 60 days normally. So 90 to 100 days is a typically carve out of a herd in Florida. And so once this started down at Big Cypress, we did this from late fall, so it would have run from about September, October, November. Sorry, I tell that long. That's when we put the sensors in. It's October, November, December, and early January is when that herd carved out. And if you flip the page to page 21, you'll actually start to see some preliminary results here. And so the Big Cypress Ranch there, first of all, we couldn't get 110 cows out of that herd down there because that year had a very low pregnancy rate in itself. And so we ended up only being able to get 80 cows. And we ran the study on 80 cows. And one of those died, so we had 79 cows enter the study. The one that died was actually a pen problem, so it was us working cows, and that's something I wouldn't typically put into this sort of study. Of those remaining cows, 77 calved, all right. One cow failed to expel the sensor. This is sort of important. And no fetus was present at the end of the calving period when we looked at that cow. So that means we either got it wrong, not me, but I won't say who. We either got it wrong in terms of actually ultrasounding, and that is possible. There was probably liquid and all sorts of things in that uterus at the time. But that's one way that calf loss, it's not a true calf loss, but calf loss may be interpreted because we've actually misidentified pregnancy in the first rate. And so it happens a very, very small amount of the time. And in this particular herd, 13 calves either died, which is a lot, or would have died because their actual cows died later in the season. So something was going on in this herd that was pretty rough, because that actually works out to be about 18.25% loss after palpation or after ultrasound. Now, if you look at the graph, who can tell me when the most calves, or the highest percentage of calf loss is occurring? Hands up. Anybody? First 2 days. Absolutely right. So, and that is actually true across the nation. Why is that? Because giving birth's hard. All right. And so if we're as a livestock industry, if you're only losing 6%, you're actually doing extraordinarily well in general. Okay? In general, that's really, really hard. So there's about 3% of that 6%, or 50% of it, occurs in that first 2 days. And most of it probably during the actual birthing event. So it's a stillborn. So we actually have these stillborns. Now, what causes a stillborn or very late stillborn could be all sorts of things. I mean, you can probably think of half a dozen things at the moment. So, wrong bull, incompatible bull, stress on that cow, possibly infection of some sort, vaginitis. There's quite a few other things that come to mind. But after that, if that calf then stands, the next sort of set of things that really cause death in calves is really a failure to thrive. So do they suckle well? Are they getting that colostrum? Is that colostrum actually good colostrum? And Philip talked about taking IgG just after they've taken their colostrum and making sure that it's actually been absorbed by the stomach and entered the calf's actual bloodstream, so it has that maternal antibodies protection. I say that because it's probably pretty important and one of the most important things that we're seeing. And if we flip over to the next page, flip over to the next page, number 22, you can actually see I've listed a few causes of mortality there. So early losses, less than 7 days, have either been to do with dystocia, or which is stillborn, so problems in actually birthing. But a lot of these were complicated because when we actually grab that calf, and every single calf we find, we take for necropsy, and we look at it really thoroughly. Many of them had associated bacterial infections, all right, and systemic bacterial infections. And sometimes these calves live for 3, 4, 5, 6, 7 days, maybe even longer. And they have systemic bacterial infections, and you've probably seen joint swelling. That's often an indication of sort of bacterial infections. But most of these infections seem to have actually been coming through the navel or the umbilical cord. All right? In Florida, we live in a extremely moist, extremely warm, and a perfect sandy soiled habitat for high levels of bacteria. You don't have to answer this question, but how many people here have had like a MRSA bacteria infection, an infection that actually was really hard to get rid of? Anybody? I have. Anybody? I would have expected about 15, 20% of people in here probably had a really bad bacterial infection from living in Florida. It's a bacteria that is not going to respond to antibiotics very well, okay? And it is actually out in the environment here a lot. One of the bacteria, actually I want to mention two particularly. Two of them are associated with abortion and late abortion extensively. One of those is Trupperella pyrogens, and we're finding that regularly on these calves. And the other one is Klebsiella pneumonia, which you'll often get if you send a calf in for necropsy, you'll often get a result that says it died from pneumonia. Do you get that? It's actually true, but knowing what it is really important. And those Klebsiella pneumonia and Trupperella pyrogens are both bacteria that are actually causing that calf to die, potentially sometimes in utero. Trupperella is in utero and being passed early. So 50% of our calves are dying from these sorts of things. So the next question is, from a perspective of management and extension, what can we do to help that? And that's actually a really hard question to answer. There was a graduate student in here where we were giving a talk, and I can't remember who it was, but mentioned something that they do in in Brazil is they often herd all their calves in early, or they actually have birthing pens, and they will actually disinfect that navel umbilical cord region all the time. Now, on small herds, that's probably possible here, and after doing this, I'd probably recommend it, because I think you would actually save quite a few calves' lives by doing that. All right, so the next ranch we did was actually over with Cliff Coddington at Longino Ranch. And Longino is quite different from the Big Cypress Ranch. The Big Cypress Ranch is actually knee-deep in water 3/4 of the time of the year. There's a lot of water down there. It's amazing how much water's on that place. And it was pretty wet year. Cliff's is quite different. It actually dries out more. And you'll actually notice that in terms of Cliff's place, the percentage of calves dead, at least for the first 45 days, is a lot less than what was happening at Big Cypress. And he's right round the national average, actually under it, about 5.4%. But the ones we did find at Longino were suffering the same sorts of things. So they actually were coming back with a similar types of bacterial infections, and they were actually about the same split in terms of those that were being caused stillborn and those that actually potentially died from bacterial infection later on in the first 3 or 4 days. And one thing to actually really note there, though, is that out of all of these calves, and there's probably 25, 26, maybe even a few more now that have actually died across all 3 of these ranches, we've only found 1 predator event, which is pretty interesting. And that event was on Longino Ranch. And the way we found it was because the ear tag that you had stopped signaling to that tower, completely disappeared. So what do you think happened? No, the tag was still there. Yeah, but we couldn't hear it at all. So it was separated from the calf. Well, we never found the calf, but Cliff and the field technician eventually found the ear tag 1/2 mile from where it was supposed to be in that pasture. How it got there, I have no idea. In the grill of Cliff's truck, I don't know. But I don't think so. No. And they actually found it basically by stepping on it, because it's actually really hard to find them. Yeah. Which is really interesting to me, because I would have expected a little more predator results across these places, especially down in classic panther habitat where panthers were walking by. One of the problems is, and we're trying to alleviate this by actually not being in those pastures all the time, was having these birthing sensors go off. When you have 20% of them that are not working, we've got to go and actually check on that a lot more regularly. And riding herds and being in pastures is a really good deterrent for predators. So if you do have a predator problem, that's one thing you can do, is actually get out there and ride pastures as well. So I've asked, especially on the Big Cypress Seminole site, is what predator effects are we actually seeing on the neighbour's property, and are the places that we're actually at a lot less than what's occurring. The other thing you will find is that predator events, and one of the reasons you should do these studies over multiple years, is predator events are not continuous. They're not the same every year. They go up and down. I'm pretty sure most of you who have ever had a problem with predators is that it often spikes. So you'll have one, and then it'll actually you'll have quite a few, and then either you remove the problem animal that's causing these issues, or it just stops, and then it goes away for a while. And then it might come back, and you don't know. So it's sort of stochastic. Anyway, so the next part of this study is to continue this. This is really year 1, and we've done 3 herds, and we want to do multiple years so we actually can increase our sample size to approximately 100 calf deaths, and to actually really know what is going on with these calf deaths. And I really want to thank the Bronson Animal Disease and Diagnostics Lab. I don't know if anybody is here from the lab, but they've gone over and above trying to actually make sure they track down every little problem that's occurring with these necropsies. Bridget, do I have 1 more minute? Yeah. So I want to actually explain a pretty interesting one. Well, it's actually two examples here. Who knows what pseudo-rabies is? Know what pseudo-rabies is? So it's not rabies, right? All right. It's a herpavirus, and you might know it by the name of mad itch. All right, and people's dogs, typically hunting dogs on pigs, feral pigs, will actually pick up pseudorabies occasionally, and it's a terrible death for the dog. They'll chew off their own skin and do all sorts of things and scratch. Did you know cows can get pseudorabies? Yeah, so occasionally they get pseudorabies. So this is a story about a potential pseudorabies. It's a story about Raoul getting headaches too. So pseudorabies, if contracted, is a virus that will probably kill a cow within 3 to 5 days. We had an event where a calf was actually lost quite a large proportion of its hair, all right, on its back. And it lost a lot of this hair, seemingly because it kept chewing on its back. All right, so it's chewing on its back, and it's actually staggering around while it's doing this. And this was observed by the field technicians. This is day 2 of its life. And we're like, okay, we need to look at this calf. We need to figure out what's going on. So we draw blood. We have a discussion. There's a couple of veterinarians involved. And that's another thing I should say. The veterinarians are actually called into these things as much as they can and give their diagnosis as well. And one of the veterinarians says, we should check for pseudorabies. I'm like, okay, that's a fair enough diagnosis at this point. So we take blood, we do this, we check, we take skin samples and some hair samples. We look for mites, no mites. We look for other sorts of organisms, no other organisms particularly present. And then we look for things like fungus or fungi, because fungi can actually cause bad skin irritations. We send off this pseudorabies potential sample, and the first thing you need to know is that pseudorabies test is not validated to be done in cattle, okay, but they will do it. All right, so it goes off to the lab, and guess what, it comes back positive, and you go, oh, this is a problem. So as soon as a pseudorabies, it's a reportable disease in cattle, so as soon as pseudorabies is actually potentially seen, it starts a trigger of events. And so it actually goes right through FDAC's reportable diseases, and you start getting phone calls. And that's where my headaches start. Why did you send this sample there? We can't do this. We can't do that. And so you can do this, but it was then sent off again further. And it's a good point. That calf is still alive. So did it have pseudorabies? It's now a month old, 3 weeks old. It didn't have pseudorabies. It doesn't have pseudorabies. It would be dead if it had pseudorabies. But the test that was actually, remember, non-validated, does actually say that it potentially had pseudorabies. And so these things are really important to actually track through fully. And so with the lab, we did that, and more people got involved. And we actually retook samples on that calf, but it doesn't have pseudorabies. So that's one really nice example of things that can go wrong, but you need to actually follow up with. It eventually came back. It had a bacterial infection on the skin, and the topical antibiotic that was placed on that skin cleaned it up pretty well, and within 3 to 4 days that calf was walking around, doing fine, still nursing, so it's good. So we also had, I'll give you another example of something that we do. So we have a cow that's wandering around in the field. We think it's going into labour, but we haven't had our sensor tell us it has not been expelled, and it looks like it's struggling. And we go, okay, what's going on with this cow and calf? And the field tech checks on it day in the morning, in the evening. Still, I'm getting little phone calls saying this calf's still having problems. I'm not sure cow is still having problems. Not sure what's going on. Next day we go out. Cow's actually down now, so really big problem. So we go to the cow, try to get her up. She's not going to get up. We eventually get to the point of saying, okay, what's going on with this cow? Starts to smell. You can smell the cow. I mean, people been around cows will know. You know the smell. It's not good. Cow's actually still alive at this stage, but we decide at this point in time it's time to put this cow down and euthanize it. But we do that, and then we actually say, okay, we're going to take this whole cow and calf and figure out what's going on with this cow and calf, and that's part of this study. Why did that cow, as a pregnant cow, die with this calf? And it's one of the causes of calf loss. So we send the whole cow and calf to the lab, trailer it up to the lab, right? And we go through a whole series of processes of looking at all of the organs in the lab, all of the organs in the cow, all the organs in the calf itself. So this is a really interesting case because the calf seemed okay. All right, it came back pretty clean on all of the things we're expecting. No bacteria, no big problems. The cow, on the other hand, came back positive for leptospirosis, and it was in the kidneys, and it was the only place we could actually find it. And there was no true antibody response in the serum of the cow. And chronic infections of leptospirosis will actually do that. So it will actually probably have originally had an immunoglobulin response, but it's actually burnt it out and there's no longer any response to it. So they believe that leptospirosis in this case has actually killed that cow. And that's a cow that we also believe has been vaccinated for leptospirosis. So as another point is that all the things we do try to do well, there are some individuals that it doesn't always work for. It's not that the vaccine's bad. This is one individual out of a whole herd. It's just that it didn't work for that cow, or somehow still contracted the actual leptospirosis. So I think they're a couple of great stories, and there's lots more of them. Nearly every case has a story like that. What we're trying to do now is compile all of those stories into major factors that could have driven the reason of that calf loss. And hopefully, well, at the end of this year, there'll be one report. At the end of next year, there'll be another report detailing all of those causes. All right. Well, thanks for listening. If you've got any questions, you can ask a few now, or you can find me later. Thank you.